you're looking for Dr. Eclipse. Well, I'm a student, and tonight I'll be doing your cranial nerve exam. Please don't be afraid. I'm really competent, and I know what I'm doing. So please, take your seat. Yeah, right in front of me. Do you feel comfortable there? Okay, awesome. That's great. Well, if you are ready, sure. Let's confirm your personal data first, if you don't mind. We actually have everything in our system, but just in case, to be sure that everything is up to date, your address, your email address, your phone number, right? Yeah, sure, just to avoid some inconveniences and inaccuracies in the future, right? Okay. So, your first name would be... Right. Your last name? Okay. Great. Good. Now, your home address. Sure. Could you spell that? Yeah, the name of the street. Oh, okay. Now got it. Good. And then your email address. I hope it's not a secret. Sure, yeah. We'll just be able to email your results later, so I think it's quite convenient, right? It will save you a lot of time, that's for sure. Okay. And I'll do. Okay. Right. And your phone number. Okay. 9 or 8? Okay, wonderful. Yep. Well, now please tell me, how have you been feeling lately? Okay. Today in particular? Alright. Do you ever have dizziness when you wake up in the morning? It kind of flashes in your eyes. Right. Does it ever happen that everything becomes blurry in a moment? How long can it last? Okay. And then how quickly does it blur out? Alright, got it. Okay, now what about your hearing? Does it ever happen that you don't hear some sounds, noises that all other people can hear? Okay, well, it can randomly happen to any of us, basically, yeah, so there is nothing unusual about it. Yeah. Well, but in general, if it happens too often, if the symptom is very repetitive, so then it's kind of a bit worrying. Okay. Well, and does it ever happen that your ears are kind of clogged? That you can hear everything but not very well, or like as if it's on a very big distance from you, though it's not really that way. Okay, I see. Well, then what about your balance and coordination? Does it ever happen to you that it's hard for you to keep a balance, that you... Okay. Have you ever fainted? When did it happen? Okay. No, I get it. Totally. It's fine. Please don't worry about that. There can be multiple reasons for that too, so I just want to make sure that it doesn't happen too frequently. Okay. Well, that's great. Now, what about your sense of smell and taste? Any unusual themes, any difficulties, any troubles with that? Have you noticed anything weird about it lately? Okay. Well, that's... I know that it happened to many people after catching some virus, some kind of cold even. So, but in most cases, it gets back to normal pretty quickly, pretty soon. If it stays that way for a long time, then again, it's better to see the doctor. Right. What about your sensation? Do you ever feel any kind of numbness in your face, anywhere in other parts of your body? Okay, does it ever happen that you have some kind of tremor, like trembling hands, shaking hands, maybe legs, whatever? Okay. Okay, got it. Let me type in some of your answers so that we don't mess up anything, okay? Okay, great. Thank you. We appreciate your patience. Oh, Chris. By the way, when was it the last time when you had your cranial nerve exam? Not so long ago. And maybe some other kinds of exams, maybe a separate eye exam, ear exam, some kinds of hearing tests that you've had lately. And when exactly was that? When it comes to your blood pressure, does it ever happen that you have some kind of hypertension, hypertension, like low blood pressure or extremely high blood pressure? What's your normal blood pressure? Do you know it? Okay. Well, thank you. I guess that we will start with your blood pressure, if you don't mind, since we talked about that. And I think that it makes sense to check it right away. Now you seem to be very calm, and your blood pressure is basically supposed to be like the way it is normally would be for you. So I guess that it shouldn't be either too high or too low. Yeah. So since after you answered all my questions, it's been, I think, more than 5 minutes since you entered the room, my office. I mean, Dr. Eclipse's office, actually. Yeah. So what I mean is that basically, now it's supposed to show us your normal blood pressure. Yeah, the one that you have normally on a regular basis, right? Well, what I need to do is to put the scuff on one of your arms. You can choose if that's right or left. I don't really care. Doesn't really matter to me, right? Alright. Okay. Let me put it onto your biceps. Yeah. Just exactly that way. Oops. No, it's gonna be alright. No worries about it. Okay. Okay, I'm not gonna put it too tight for now, but in the process, when we start, it will tighten on your arm like that. It might be a little bit unpleasant, I won't lie, but it is bearable, right? You'll survive it, so no need to worry about anything, okay? Okay, so just try to relax. It won't take too long. Ready? It's alright. Okay. Well, good news. It says that your blood pressure is exactly like what you told me. So, the one that is normal for you, and it's actually quite common, quite normal. There's nothing to worry about. Your pulse is okay as well. Okay. Yeah, totally. It's fine. Okay, now let me take it off, okay? The scuff. I know it's not very pleasant when it's like that on your arm. It's a bit too tight, very far from comfortable, but still, you did it. I'm very proud of you. Well, and now, I think that would be great to also check your other vitals. Yeah, take your vitals. I mean, just I will listen to your lungs into your heart, okay? Once again, the only thing that might be a bit unpleasant about it is that this thing might be a bit too cold, but I'm sorry in advance. I'm sure that you'll handle it as well, okay? Good. Are you ready? Good. So please breathe in. Now breathe in, out, right? Good. Now once again, breathe in and out. Good. Now once again, breathe in, out. Okay, now I will ask you to hold your breath, okay? So please breathe in and hold there. Out. Once again, breathe in. Out. Okay, amazing. Now please turn around. Okay. Once again, breathe in. Hold there and out. Once again, breathe in. Out. Okay. And now could you please cough for me? Once again. Good job. Okay. Great. Well, thank you. Thank you so much. Once again, thank you for being patient. And it is really great that you already have some experience of these kind of medical exams, so it's so much easier to work with such patients. Yeah, okay. I will just add some more information to your profile, right? Okay, well, now I think that we are ready to start the actual cranial nerve exam. I might take your pulse at the end of all our appointments, but that will okay. I'll put on my latex gloves. Somehow they look a bit different, like different shades of by the way, what color is it? Right, yeah. So it seems to me that these are two different shades of blue, but I swear they were in the same box. So anyway, let's start. For a change, let's start with your hearing. I know that very often we can start with some light tests or with the olfactory nerve, like smell and taste and stuff, but I guess today we'll leave it for desserts. Because yeah, those tests can be real fun and we'll definitely do that. But let's start with your hearing, right? Especially after what you taught me about some of your symptoms, okay? That would be great. Well, the first thing I'll ask you to do is just to tell me how many snaps you can hear, okay? How many snaps you've heard, actually. Please don't look at my hands. Yep. So this is your hearing test, not your eye exam, not the visual one. Okay. Ready? Let's go. Wonderful. Now once again. Good. What about now? 5 times. Okay, wonderful. What about now? Just once. Exactly. Okay, now, since it seems to be so easy for you, let's make it a little bit more challenging. Tell me which side it is, okay? Which side the sound is on. Okay. Thank you. Okay, good. Good job. Okay, you can do it too. Now let's combine these two tasks together. You will have to tell me how many times, how many snaps you've heard, and also which side they were on. Okay, you can do it. I believe in you. Okay, now. Exactly. Amazing. Good job. Okay. Now, tell me when the sound changes its direction. Okay? That should be quite easy. That's right. Exactly. Amazing. Okay, good job. Now I'll whisper some words for you, but so that it wouldn't be way too easy and boring, I will make some background noise with my hands, with my latex gloves basically, right? A lot of patients find this kind of sound quite relaxing, by the way, so maybe you will find it this way too. Okay, so what I was about to say is that I will make this background sound noise and you will just let me what you've heard, what I've said, okay? Okay. Medical exam. That's right. Vision. Exactly. Christmas tree. Dessert. Pancakes. Ice cream. Alright. Oh, 100%. That's quite impressive. Give me a moment. Well, I must say it's not particularly convenient, comfortable to type in these latex gloves, but anyway, it happens. Okay. Right. Now, what I'm about to do next, I have such wooden I will basically like produce some kind of a rhythm using them, okay? And you will simply have to tell me if it is like homogeneous, so like the same kind of sounds, the same kind of intervals, pauses between them, okay? Or if it is not homogeneous at all, if it's like different, if the pauses between the sounds are different, maybe the sounds are different in the volume, pitch, whatever, okay? So like, and stuff like that, okay? Okay, great. Just try to relax, okay? Good. What kind of sound it was, in your opinion? What you heard? Okay. Now, please listen again. It's just a bit. Right, yeah. Okay. Now, please close your eyes and tell me which ear the sound is closer to, and also if it's like the same kind of resin or if it's different. Okay. Which side was that? Okay, amazing, good. Which side was that? And what about the resin? Good. Okay, you're doing great. Now, the tuning fork. I suppose you probably already know what kind of tool it is. Anyway, I will put it behind your ears and then on top of your head. You will simply let me know when you can't hear the sound and feel this vibration from the tuning fork, okay? Yeah, just as easy as that. Okay. Okay. Good, right, yeah. And what about now? Wonderful. Alright, and what about now? I'll put it on top of your head. You will have to tell me the same when you stop hearing the sound and vibration. And also, please pay attention if it's quite symmetrical on both sides, or if on just one side it is louder than on the other one and stuff like that, okay? How was it? Perfect. Okay. Got it. That's wonderful. Well, I guess that with your hearing test, we're basically done. But let me have a closer look at your ears just for a moment, okay? It won't take too long. Okay. It's alright to me. Have you ever had any kind of earwax buildups? Okay, how often do you actually clean your ears? Can I trust you? Oh, just get in. Now your ear is all right. So your ear canal seems to be just fine. Yeah, I don't see any issues with that. Doesn't seem to be clogged or something. I don't see any buildups and stuff, so that's totally fine. Let me also touch them for a moment. Can you feel anything? What if I press this way? Do you feel any kind of ache or pain? Okay, perfect. Please let me type everything in. Okay, so you've heard all the whispered words. You managed to count how many snaps and other sounds you've heard. You taught me when the sound changed its direction, its side. Then the test with the tuning fork was alright as well. And the visual ear inspection was perfect too. So with your ears, I think that you don't need to worry about that. That's right. Okay, now let's do olfactory. Okay, I promised that would be for dessert, but why wouldn't do it now? I think that it will be a really good break for you. So usually when we do olfactory nerve and stuff, you don't really need to think hard, you don't need to concentrate too hard. It is fun, it can be unpredictable sometimes. So usually our patients really enjoy this kinds of tests. So I just want you to get some good rest, right? And then afterwards we'll switch to eye exam, where you will have to work a little bit harder again. Not too hard, please don't worry about that. Okay, so this is the kind of test. I will start actually with your sense of taste. Okay, so it's not actual olfactory, and olfactory is more about the sense of smell, right? But I do not want you to overwhelm you with all this kind of information now. Yeah. Well, you will have to open your mouth, stick out your tongue a little bit, and no need to say we'll do that later. So I will just drop a little amount of this liquid. It's flavored, and I will drop it onto your tongue. Good. Take your time. There is no hurry. And please just tell me, what does it taste like? What is it similar to? Okay. Are you sure? I'm just messing with you. You're right. Yeah, this is just strawberry. Very standard one. Very recognizable taste, I think. Okay. Now let's go to another one. The same thing. Stick out your tongue. Okay, perfect. Once again, there's no hurry. Take your time. Yeah, the bottles are all the same. I know what is what. There's some like slight difference between them, but for you, it won't be that noticeable. That's the way it should be. So just to avoid giving you some hints, like for example, when people think that if it's green, it's like an apple or peppermint, and if it's red, then it's definitely some kind of strawberry or other berry or something like that, and if it's yellow, it's definitely lemon or something. So yeah, that's why all those nice bottles with this starchy syrup, flavored starchy syrup, are basically the same. Tricky. Okay, so what kind of flavor do you think it was? Banana, right? Yeah. Okay, let's do the next one. Okay, that will do. I think. Now, the same thing. You know what to do. Oh. Oh, is that bad? Yeah? Okay, good. I'm sure it's alright. What does it taste like? Grapes. Amazing. Good job. Good. Yeah, she did it right. Now, I'll get the cotton swab and I will let you take a smell. Okay. Let's take a smell. That's alright. We are not in a hurry, so you can take as much time as you need. Okay. Well, what does it smell like to you? It is definitely spicy, kind of like. Yeah, it is cinnamon. Okay, good. Now let's take another one. I spray quite a big amount of this. They stir this scent onto the swab so that it would be easier for you to feel it right away. And now all the room smells like it. Yeah, seems like we were making some mulled wine in here. Okay, so what is it like? What? Are you sure? Okay, cherry it is. Good job. Let's try one more time, okay? You are not sure about the second one, so I just want to make sure that everything is alright with your sense of smell. So, what does it remind you of? Do you need more time? Would you like to take a sniff one more time? Once again. Okay. What do you think it is? Yeah, that's kind of easy. Yeah, chamomile it is, right? Okay, good job. It's actually very impressive, I must say so. Not all our patients can guess all of them right. Even if you made some mistakes, it would still be alright, but you are showing really great results, so that's definitely above average. Yes. Okay. Good. Well, I guess that you had some fun. You got some rest from this other test, and now let's do some serious stuff again. I'm just kidding. Nothing serious, I promise. Okay. So, please follow the light for me. Okay. There is no hurry. See, I'm moving it quite slowly. But please don't move your head, your eyes only, with your eyes only. It's really important, okay? Okay, wonderful. Good job. Now, please concentrate on my nose, on my face. I will move my hands a little bit. You will let me know when my hands, when my fingers leave your vision, okay? That's right. Good. Right. Exactly. Okay. Good job. Once again. Now, pretty much the same, but just the other way around. Tell me when my fingers appear in your field of vision. Oh my goodness, these gloves make some kind of noises. Sorry. It's a very standard test, nothing unusual, nothing extraordinary. Okay, now please tell me when my fingers wiggle, but also concentrate on my face. Now we are testing your peripheral vision. Yes, your side vision, your peripheral side, whatever you call it. Yes, absolutely. Tell me when my fingers wiggle on either side. Good job. Okay, wonderful. Now please follow my fingers once again. And now blink. Okay, good job. Now once again, follow my fingers, relax, and blink. Okay, wonderful. So your corneal reflex works just fine. Okay, now let me have another look at your pupils, okay? If you don't mind. Now once again. Good job. Now to the other one. That's alright. And now this. Okay, don't see anything alarming there. Can I touch your face slightly around your eyes? Is it okay? No, it's not gonna hurt, but if it does, please do tell me. Okay, what if I press here? Good. Okay, no, it's just fine. Now, your eyesight, like I promised. We'll do some easy tests. Relatively easy. Nothing too challenging, nothing too hard, okay? I have plenty of cards here. As a medical student, it was one of my tasks to actually make them, like different cards that can help in testing your color blindness and some other things about your vision. Okay, so you named the color of my gloves just right. Let's see how your eyes react to other colors, okay? What color is it? Okay, I'll accept this answer. What about this one? Now, how would you know this color? What about this? And what about this? Well, actually, it wasn't a mistake. You see, these two colors, these two cards, do they look exactly the same to you? Now, are you sure? And once again. So, what do you think? What would you say? How would you characterize them and the difference between them? Okay. You see, it all depends how close I pull them together, right? On the distance, they look quite alike, but then compared more closely, you can see the difference. Okay, amazing. Now, of course, what about this color? This. Something like that. And this. Comparing to the previous one, this one is darker. Okay. Great. And now this color. Amazing. Oh, of course. You're absolutely right, so you're not colorblind. Now, we've checked your sense of smell and your sense of taste, but what we also need to do is to have a closer look at your mouth cavity, at your throat. If you don't mind, I'll use the spatula. Okay, and I'll use the light. Alright, okay. And say ah. Perfect. Good job. Now, if you don't mind, I'll put my hand on your neck. Please swallow for me. Good job. Okay, good. No, that's fine. That's alright. Now I will check if you can breathe with your 2 nostrils. Saying well. Okay, so if you can do it easily with both of them separately. Okay, let's do it. Please close one of your nostrils. That's alright, that will do. Good. And press in. Awesome. Now with the other one. You can breathe out. No, it's fine. Yeah, you can do it. Okay. Do you ever have any kind of nasal congestions? Right. No, I see that. I mean, it's pretty common when you have some kind of a cold, so that's inevitable, I guess. Okay, let me type it. Now let's check some of your reflexes. Put it on your chin. Now, this, my friend, is a percussion hammer. And I will just check your knee-jerk reflex. Yeah, you can keep your legs that way. That will do exactly. Perfect. And do the other one. Exactly. Wonderful. Now your wrists. Okay, and now your elbows. Perfect. Okay, wonderful. Thank you. Okay, now your sensation. Don't be scared. I will slightly touch your skin with this thing. It's not gonna cause any kind of pain. Don't worry. Close your eyes and just let me know when you can feel it on your hands, on your forearms, maybe on your face, okay? And you can tell me where exactly you can feel it. Okay. Close your eyes. No cheating. Good. Where exactly was it? Alright, good. What about now? That's right. What about now? What finger was that? Exactly. And now? Okay, good. What about now? And once again, on the other cheek. Okay, good. Right. Well, what can I say? You did extremely well. Seriously. So everything was great. Your sensation seems to be just fine. Your reflexes are alright. Let's now check your movements, like the way your muscles react. And how you can actually move your face muscles, your facial muscles. Could you please raise your eyebrows? Wonderful. Now, could you please frown as if you are not happy with me? Exactly. Okay, now please puff your cheeks. Like that. Okay. And now puff them again. Don't let me close them, okay? Okay. Perfect. Good. Now please shrug your shoulders. Let's see how well you can resist me. Good job. Okay. And now you can put your shoulders in normal position. I will try to press on them and you will try to raise them, to shrug them, okay? Try harder. Exactly. Wonderful. Okay, thank you. Now, could you please reach my palm, my hands with the opposite hand of yours? Okay, good job. And now with the other one. Wonderful. Okay, good. Then please put your hands, your arms this way. Okay, I will try to move them apart, okay? You have to resist me. Once again. Okay, good job. Right, now please would you try to reach your shoulder with the side of your head, with your ear, let's say. Okay, like that. And now to the other side. Perfect. Okay, now like I promised, is it okay if I measure your pulse again, if I take your pulse? Just to see how you reacted to all this tests, if after being a little bit tired, if anything changes and stuff. Okay, your hand please. That's alright. Yeah, it's totally fine. Okay, I'll just follow the time. Keep the track of it. It's totally fine. Like I said, there is nothing to worry about. Okay, thank you so much. I guess that we basically have done everything we were supposed to, as far as I can see. Yeah, you did really well. Let me enter some more data, because afterwards we actually have a lot of patients today, a lot of exams, so that I don't forget anything. I want to put it all in right away, not to mix up later, because I guess Dr. Eclipse won't be happy with me if I mess something up. Okay. Yeah, sure. Oh, she's great, yeah. But she's pretty strict as a mentor. I guess the way she should be. Okay, we're almost done. Do you have any questions, by the way? I guess I never asked. Yes, so maybe there is something you'd like to ask me, or maybe in the process you had some ideas of what you wanted to discuss with me. Anything I could help you with? No, if you're sure. Of course. You can think about it for another minute. So, have you come up with anything? Okay. Yeah, I guess the next time, well, you need to do your cranial nerve exam will be maybe in a few months. Okay, it can be sooner if there are some issues, but other than that, but you can have more appointments with more specific, like narrow, specialized exams, like a separate eye exam, ear exam with a more extensive hearing tests, like beep tests and stuff like that. Also more sensory tests and stuff. I mean, it won't hurt. Sure. Exactly. You're absolutely right. I like your approach to your health. I think if all patients were this way, then we would have much less work to do. Because it's always better to prevent something than to cure it, actually. Yeah. Exactly. That's right. Okay. We'll see you soon. We'll email you all this data. In case you have some questions, please do call us or just come to see us at our clinic. Yeah, sure. Have a good one. I'll see you. Thank you. Bye. I'm gonna examine your ears using the otoscope. I suppose you already know how it works as well, but anyway, so it's not gonna hurt, I promise. Don't worry. Good. Good. Alright. Yeah, that is what I'm supposed to see. Alright, give me a second. Okay. The other one. So I will hold your ear really gently. Give me one more second. I'd like to see it in more detail. Alright, and now I'm gonna press on your ears really gently. But please do let me know in case it hurts or in case you have some discomfort. Okay. Good. Do you feel good? Wonderful. Alright, that's actually what I expected. You have really, really tiny earwax buildups. Usually, the earwax passes out of your ear through the ear canal easily and harmlessly, but sometimes it simply happens that some earwax buildups can be formed. So there can be multiple reasons for that. Sometimes these are simply individual peculiarities, so the canal can be too narrow, or the earwax itself can be simply too hard and thick, but sometimes these can be also some factors, like some external factors like earplugs, the frequent usage of earphones and other stuff. So I'd recommend to do this short ear cleaning. So since scrape.